Back again with the Ross County Health District. We have with us Ben Avery and Michelle Long. Say hi.
Afternoon.
There they are. Last time we talked, we've had many things happen. It's been a little over 7 days since we last visited in regards to the COVID-19. Numbers are up as we are recording this on Tuesday, March 31st. Boy, we're talking 1,767 more cases confirmed now than when we last spoke. And unfortunately, 55 have died from the COVID-19 virus. We now have 2 confirmed cases here in Ross County. That's also something new, Ben.
Yes, we've had 2 cases back to back here these last couple days. So things are definitely starting to pick up here in Ross County, much like we had suspected. I believe these were cases that were related to travel and not community spread, but it's still a significant occurrence.
And that creates some busy activity for Michelle because now you're in the middle of trying to track down who all these people have had contact with.
Yeah, actually, I've been quite pleased that these are 2 individuals who actually took the stay-at-home order pretty seriously, other than essential needs to leave their home. And so it's actually been a lot of work, but it's been a lot less people to contact than it could have been, based on what I've heard from other health departments where there's 300 and 400 people to contact. So it's kind of shows why it's a good idea to stay at home, because if someone does contract the virus, it works on the capacity, makes people tired that have to continually try to get a hold of all these people, and it's not always an easy process. So that's why it's so important to go with the orders.
Yeah, this contact tracing is probably one of the most important things that we can do to mitigate the effects of the coronavirus, is getting a hold of those people that were in contact with the positive case, letting them know the information they need to know and telling them how to properly quarantine. It could really reduce the numbers here in Ross County. So as we move into this next phase, the contact tracing is going to become very important.
As you mentioned before we started talking, we're still in the mitigation phase. So still in that stay-at-home mode. And what is the next phase that we're looking at?
Well, I think it's basically going into the ops phase, implementing isolation centers, those types of things. The hospital is going to have more patients to treat. We're going to be working with the jails for sure, nursing homes. I think there's going to be positive cases in all those situations. So just managing those situations as best as we can as a community to try to provide the best service for those in Ross County.
I know since we last visited in Columbus, the convention center has been designated as a spot to handle a surge. Are we seeing locations around Chillicothe in the Ross County area, perhaps some of the high school gymnasiums, perhaps as being designated spots that might help with the surge?
Yes, that's something that we've been working on for the better part of the last week, is identifying those locations. Adena has plans in their emergency response plans for surge. I know they're looking at the PACCAR building to convert that for surge capacity if needed. But here in the community, one of our big responsibilities is going to be keeping those individuals that have been diagnosed positive with COVID-19 in isolation. But we also know with the limited testing, there's going to be a large number of individuals that we suspect are positive but have not been tested. So those individuals will be quarantined. So that's kind of the difference between isolation and quarantine. Is those isolated have been confirmed positive, but those in quarantine are only suspected of having the case. But in all reality, they're treated very similarly in that they need to, stay home until their symptoms subside, and for a number of days after that even. But the issue is we can't keep those that are isolated and quarantined in the same facility. So right there, we're looking at potentially 2 different facilities in the community to address, that strategy to reduce the spread. And then there can be other issues that could, make it even more complex, like we're tackling a lot of tough questions around homelessness right now. How can we prevent the spread in the homeless population? And if a homeless individual does end up coming down with COVID-19, they will have to be isolated and quarantined as well, and they're going to need some additional social supports to help them go through the quarantine process. So all of those things are being discussed in detail on the community level. No one agency is going to be able to take all that on, but together, with the Emergency Operations Center, with the county, with the DENA's emergency planners and the health district, we are going to come up with a solution for community isolation and quarantine sites.
I think that's something that's been very interesting, is to see how the community partners have come together and started working as one. And of course, yesterday, the Ross County Commissioners made the declaration of the state of emergency. That'll help cut through a lot of the red tape for financing some of this from FEMA and other different organizations. But that being said, it also gives you a little more muscle in what you are supposed to do by going around checking on businesses and all to make sure everyone complies.
Yeah, certainly the order does help. It directly authorizes, it instructs the public to pay attention to emergency orders such that we're having to issue because of the COVID-19 outbreak. The commissioners have been incredibly supportive. I'm on a number of different conference calls that are reoccurring every day, and just about every one of them has one of those commissioners on it, lending their support, their political capital. They're doing a great job to support this effort as well.
Speaking of the businesses, and I know we kind of chatted a little bit about this a while ago, I know the governor over the weekend kind of said, listen, if you are still doing the business as usual, you need to stop it and start engaging in our practices of the social distancing and everything else. I know some businesses have put the tape down and all. You guys are behind enforcing a lot of that to make sure that we are staying spaced apart the way we should be. But I guess at one point, we're asked to take our temperature before we go to work each day. Do you think anytime soon we'll start limiting the grocery stores as to how many people can be in there at a time, or possibly having their pharmacists standing out there and taking your temperature before entering in?
Well, that one's kind of a tough question, Dan. I think when the governor even asked even employers to take a temperature every day, he did not realize that you can't hardly find a thermometer, not even on Amazon these days. So that's a kind of a difficult task for everyone right now. We're just following the governor and kind of what he's going with. If a business is not does not have the equipment to be able to take temperatures every day, they still have to comply with the order. And number 18 on that order is that they have to ask a series of questions to their employees. So I think, that could be something that they would do if the governor orders that. I know that we would just follow suit with that, but I really don't know. They have opened the grocery stores and things for that extra hour for the elderly population to be able to shop, which is nice. But now they're kind of hoping that just all of them would stay home. So I don't know how that's going to turn out.
I think, Michelle and I were discussing before the call, there is asymptomatic transmission going on of this disease. So even if you were to take temperatures, there's still a likelihood that somebody that has the illness is not just showing symptoms is going to be in the facility and potentially passing the illness. So I think it would be a best practice. I'm not sure how realistic it is. And like Michelle said, we're going to follow the direction of the governor as we have from the beginning. And if he starts making more strict requirements, then we'll certainly follow suit.
Anything that we have not touched on here today that you wanted to get across to folks watching?
I continue to be impressed with how the health system, our county and our city partners are working together. It really is something that I wish that everybody could be a part of, to see there's such a sense of duty on all levels, and it really is, it should be comforting to the public to know how closely we're working together, such that, we're not wasting any time duplicating efforts, and we're all really on the same page, rowing in the same direction, and trying to produce results for the community.
Michelle, anything from you?
Yeah, I just never want the prevention strategies to get lost in all of this, because obviously we've known that it's here in our community. We already have cases here, so people need to continue to wash their hands, properly cover their coughs, clean surfaces, social distancing or physical distancing, and really, truly, if you don't have to come out, just stay in your home. I mean, pretty much even the governor's press conferences have encouraged, everyone to stay at home, and I think we just really, really need to heed that warning.
And I think we can't rely just on the health department to police this whole community. That's something that we all have a responsibility to do. So if you see something that doesn't look safe to you, I would say something. Because right now, when people are acting irresponsibly, it does affect more than just those individuals. So I would say if you see something that makes you uncomfortable, feel free to say something.
I agree.
And for those who are concerned about, well, we're giving up our civil liberties and all this jazz, didn't do this. Govern yourself as best you possibly can, and keep an eye out and help each other in that regard. And pray for Michelle and these folks, because they are really stressed as far as they can go. And let's see, you last had sleep around Christmas, was it?
January the 9th was the first time I got a call regarding COVID-19, and I have not quit since.
Well, we appreciate the efforts that you folks are continuing to do. And again, if you want to find out more, we haven't talked since you had your conference call in regards to the medical force helping out, joining in with voluntary. How did all that go? And will the Medical Response Corps, will it be ready to go?
Yeah, the Medical Reserve Corps.
I was having trouble trying to remember the name.
Actually, we still have that link, and we still are needing volunteers, because of course we live in a town where a lot of nurses and medical professionals either work at the health district or work at Adena Health System. So we're also looking for those people that are possibly work in the health field, work in the long-term care facilities. So we need more of those type of people to get on and volunteer, but we also just need those community members who we might be able to use in a lot of different ways. So they can go to our website at www.rosscountyhealth.org, and right on the very front page is, you can just click that and it takes you to Ohio Response, and they can get signed up.
Got to think, even if you have like some nursing students or high school students from the vocational school, that they would be able to help too.
Absolutely.
Yeah, we're going to take all comers for sure. And if you're a retired nurse or a retired physician or therapist, we absolutely could use your help. So please consider volunteering.
All right. How can people get a hold of the Ross County Health Department? I mean, at this moment in time, you walk up to the door, it's tough to get in.
Yeah, we just call our front desk, 779-9652, and you can get a hold of any of our divisions. Anytime between 8 and 4:30. We still have maybe 40% of our staff is on site working here, but the full 60%, the remaining 60% is at home working on the projects, and a lot of times as those projects like transportation or nutrition relate to the health district and the coronavirus. So we're staying busy, and our staff is still on the clock. So it's approaching the first of the month, and last month we had a big issue in our grocery stores with items being on the shelf. And I'm thinking specifically about WIC items and formula. If you have enough formula, just keep in mind that there was a shortage last month, so there's going to be a lot of moms out there that are looking to re-up their supply. And the same goes with all WIC marked items. Just if you don't need it, maybe consider leaving those WIC marked items for somebody with that WIC nutrition card.
Yeah, because they actually can't get a substitute like we can. So they're only allowed to choose the things that have that WIC sticker on it. So maybe, someone could choose to go with another brand.
All right. Again, that something that if you've never been involved with a WIC program before, you probably didn't know. So if you see WIC on it and it's not something you're going to normally do, stay away from it. Leave it for someone else.
Especially with the formula.
Yes, absolutely. Ben Avery and Michelle Long, thank you for your time and your efforts, and we'll talk again soon.
All right.
Thank you, Dan.